Imagine this picture. A beautiful mare, heavily pregnant. That quiet anticipation in the air. Everyone's excited for the new foal. It feels like such a positive, hopeful moment.
Mm-hmm.
But sometimes that scene can change in an instant. Suddenly, it's not joyful anticipation. It's a desperate emergency. We're going to talk about something called equine premature placental separation today. Most people know it as a red bag delivery.
Mm-hmm.
And it's critical, a true foaling emergency. So in this deep dive, our goal is pretty straightforward. We want to break down exactly what a red bag delivery is. Why is it so dangerous? How can you spot it immediately? And maybe most importantly, what are the life-saving steps you absolutely have to take right then and there? Because the information we're discussing today, well, it's literally the difference between life and death for that foal.
Yeah, absolutely. And we've pulled together insights from, leading veterinary sources for this. We're aiming to distill that expert knowledge into practical, actionable advice for you.
Okay, so red bag delivery. The name itself sounds pretty alarming. What's actually happening? Can you sort of paint a picture of that moment? What makes it such a crisis?
Right. So basically, a red bag delivery is when the main placental membrane, it's called the choriolentois, or CA for short, detaches from the mare's uterine wall. But the key is it detaches before the foal is born.
Okay.
Now, you have to understand, the CA membrane, it's everything to the foal in there. It's the lifeline. It supplies all the oxygen, all the nutrients, and it takes away the waste products.
So if I'm getting this right, it's like the foal's oxygen cord gets cut while it's still inside. That sounds immediate. Yeah. The consequences must be incredibly fast and severe.
Exactly. You've hit it right there. When that CA separates prematurely, that vital link is just severed instantly. And that leads to a sudden, really drastic drop in oxygen getting to the foal. This usually happens quite late in stage 1 of labor, or maybe right at the beginning of stage 2. And the clock is ticking loudly. If someone doesn't step in immediately to help deliver that foal, the risk of it dying is extremely high.
Wow. That is urgent. Given how serious it sounds, is this something that happens often? Or are certain horses more prone to it?
Generally, it's thankfully quite rare in most medium to large horse breeds. We're talking less than 1% incidence. But, and this is important, that number does jump up quite a bit if labor is induced artificially. And we also see it significantly more often in miniature horses.
Interesting. Miniature specifically.
Yeah. Well, technically, any breed, any age mare can experience it. Miniatures definitely seem to have a higher occurrence rate.
Okay, the urgency is crystal clear. But I imagine for someone there, maybe a first-time breeder, the big challenge must be knowing if what they're seeing is this emergency or just normal foaling. How do you tell the difference? Maybe walk us through what a normal birth looks like first, just the basics so we can see the contrast.
Yeah, good idea. Let's set the baseline. So normal foaling starts with stage 1. That's when uterine contractions begin. The mare might seem restless, maybe sweaty, pacing, showing mild colic signs. During this stage, the foal is rotating into the correct birth position. And staging normally ends when the choriolentois ruptures. That's the water breaking. You'll see a gush of fluid, the allantoic fluid, often kind of tea-colored.
Okay, water breaks. Then what?
And you're into stage 2. This starts with the water breaking, and it ends when the foal is completely out. Usually this stage is pretty quick, maybe 15 to 30 minutes tops. Now here's the key visual for a normal birth. Within minutes of the water breaking, you should see a translucent grayish-white membrane start to appear at the vulva. That's the amnion.
The amnion. Got it.
Right. And inside that amnion, you'll typically see the foal's front feet, one usually slightly ahead of the other, and then its nose. And just to complete the picture, stage 3 is after the foal is born. That's when the mare expels the rest of the fetal membranes, the placenta. That usually happens within about 3 hours.
Okay, that sounds pretty straightforward, like a sequence of events.
Yeah.
So how does the red bag crash that party? What's the absolute giveaway sign someone needs to burn into their memory?
Right. So in a premature placental separation, that normal sequence gets totally disrupted. Instead of the water breaking properly and that smooth, whitish amnion appearing, you see something very different. What you see protruding from the vulva is a bright red, kind of velvety-looking, fleshy sac.
Bright red, velvet.
Exactly. That red bag is the choriolentois itself. It hasn't ruptured like it should have. Instead, it has separated from the uterine wall, and it's coming out intact. So the visual clue couldn't be clearer, really. If you see anything reddish or maybe roughened-looking protruding first before the white sac or the foal, that is the separated CA, and it means you have an immediate, very serious problem.
Wow.
The very first membrane you see should always be that smooth white or maybe pale pink amnion. Anything else is an alarm bell.
That's such a stark difference. Red means stop, basically. Stop everything and act. It's chilling to think about, knowing the foal is trapped behind that. Why does this happen? What causes this premature separation? Are there specific risk factors?
Yeah, there are definitely known causes and risks. To understand the why, it helps to think about how the placenta, the CA, is attached. It's connected to the uterine wall by literally millions of tiny microscopic attachments. They're called microcotyledons. Think of it like microscopic Velcro holding the lifeline in place.
Okay, like Velcro.
Right. So in a red bag, these connections, this Velcro, just detaches way too early, all at once, or large sections of it. And the foal's umbilical cord is still attached to this now separated placenta, so it's no longer getting oxygenated blood from the mare.
So the foal is essentially suffocating.
Precisely. It leads very quickly to fetal hypoxia, that's low oxygen, and then potentially anoxia, which is a complete lack of oxygen. And the fetal brain is extremely sensitive to oxygen deprivation. Even a short period can cause severe brain damage. That's where you get conditions like hypoxic ischemic encephalopathy, or HIE. People often call it dummy foal syndrome.
Oh, okay. I've heard of that.
Yeah. And if intervention isn't immediate, it can easily lead to stillbirth or the foal dying shortly after birth.
So what are the main things that can cause this placental Velcro to fail?
Well, one of the leading culprits is placentitis. That's an infection or inflammation of the placenta itself.
An infection, how does that cause separation?
Bacterial or fungal infections can cause the placental tissues, especially the CA, to get thick and inflamed. Sometimes this inflammation causes areas of the placenta to separate prematurely, particularly around the part near the cervix called the cervical star. This thickening and inflammation can also prevent the membrane from rupturing normally when it's supposed to.
Okay, so placentitis is a big one. What else?
Another major one, especially in certain regions, is fescutoxicosis. This happens when mares graze on fescue grass that's infected with a specific fungus, an endophyte. The toxins produced by this fungus can cause a whole host of problems, including prolonged gestation, the mare not producing milk, and often premature placental separation. The toxins essentially cause the placenta to thicken and not function correctly.
Fescue grass. That's quite specific.
It is. Management is key there. Also, inducing labor prematurely, trying to make the mare full before she's naturally ready, can sometimes trigger a red bag if the placenta isn't fully mature and prepared for the process. And then there are other associated factors. Things like older mares might be at slightly higher risk. Mares with known high-risk pregnancies, maybe severe stress, although that link is a bit less clear-cut. And definitely twin pregnancies.
Twins? Why twins?
Twin pregnancies in horses are inherently risky. Often the placenta just doesn't develop sufficiently to support both fetuses adequately. This placental insufficiency can lead to compromise and increase the risk of things like premature separation.
Okay, so there are several potential underlying issues. Is there any way to, screen for this? Or do you really only know when you see that red bag?
That's the tricky part. There aren't specific blood tests or anything like that to say this mare will have a red bag delivery.
Yeah.
However, a veterinarian doing prepartum ultrasounds, checking the mare late in pregnancy, might sometimes spot signs suggesting placentitis. They can measure the combined thickness of the uterus and placenta, the CTUP. Increased thickness can be a warning sign.
So ultrasound can give some clues.
It can hint at underlying placental problems like placentitis, which is a risk factor, but it doesn't definitively predict a red bag delivery itself. Often, the first and only definitive sign is that visual confirmation during labor. The appearance of the red bag at the vulva. That itself is the diagnosis in the moment.
So it really is an acute event. No warning signs just before it happens, just bam, there's the red bag.
Pretty much. The only consistent clinical sign is seeing that intact, bright red, velvety choriolantua protruding before you see the foal or the normal white amniotic membrane. The foal is usually positioned normally inside, ready to come out, but it's trapped and cut off from oxygen.
Which brings us right back to that critical moment of action. If someone sees this red bag, what do they do? You said waiting for the vet isn't really an option.
Absolutely not. Waiting is almost certainly a death sentence for the foal. Time is of the absolute essence. This demands immediate, decisive action by whoever is attending the foaling. Every single second counts.
Okay, step by step. What's the very first thing?
First step, identify the red bag. Second step, rupture it. Immediately, don't hesitate.
How? With what?
You need something clean and sharp. A clean knife, sturdy scissors. You need to make a quick, decisive cut through the thickest part of that red membrane. You have to be careful, obviously, not to cut the mare or the foal inside, but you need to open it up right away to release the fluid and get access to the foal.
Okay, cut the red bag, done. What's next? Is the foal right there?
Once you cut through the red bag, you'll see the next layer. That's the normal amniotic sac, the glistening, transparent white one that should have appeared first. This sac also needs to be ruptured quickly. Usually you can just tear this one open with your hands. The goal is to free the foal's head, especially its nose and mouth, so it can potentially start breathing.
Right. Open the red bag, then open the white bag, then...
Then you need to help get that foal out fast. Check its position quickly, hopefully. You feel the head and 2 front feet. Then you need to assist the delivery. Gently but firmly, pull the foal's legs. You want to pull in a sort of downward and backward arc towards the mare's hocks, working with her contractions if she's having them. Quickly, but don't use brute force.
Okay, pulling the foal out.
As soon as the foal's head is out, immediately clear any remaining membranes or fluid away from its nostrils and mouth. Make sure its airway is clear.
What about the umbilical cord?
Good question. The cord might still be attached. If the foal seems okay, like it's trying to breathe, you can actually leave the cord intact for a minute or two. That allows a bit more blood transfer from the placenta. Unless, and this is a big unless the foal is in obvious distress, not breathing, looking very weak. In that case, you might need to clamp and cut sooner to start resuscitation.
How do you clamp and cut?
If it doesn't break on its own fairly quickly as the mare or foal moves, you should clamp it. You can use proper umbilical clamps if you have them, or even just clean string tied tightly. Clamp it about 1 to 2 inches away from the foal's belly. Then cut the cord on the placental side of the clamp. After it's cut, it's crucial to dip the remaining stump on the foal's belly in an antiseptic solution. Something like 2% chlorhexidine or a dilute iodine solution is standard.
Okay, clamp, cut, dip, and resuscitation.
Yes, you absolutely must be prepared for that. If the foal isn't breathing or its heartbeat feels very weak or absent, you need to start rescue breathing immediately. That's mouth-to-nose resuscitation for foals, and potentially chest compressions as well. And importantly, amidst all this chaos, someone needs to call the veterinarian. Even if you manage to get the foal out and it seems to be breathing, both the mare and the foal need urgent veterinary assessment.
That's a huge amount to do under intense pressure.
Okay.
So let's say the attendant manages all that. The foal is out, breathing.
Yep.
The immediate crisis is over. What comes next? What are the concerns for the foal and the mare after a red bag delivery?
Right. Getting the foal out alive is the first battle, but it's often not the end of the story. Foals born from a red bag delivery are automatically considered high risk. The biggest concern is usually the effects of that oxygen deprivation they suffered. Hypoxic ischemic encephalopathy, HIE, or dummy foal syndrome is very common.
What did that look like?
It can range quite a bit. Some foals might just seem a little disoriented. Maybe they don't nurse properly, wander aimlessly. Others can have severe neurological problems like seizures, or they might be unable to even stand up. They're also at a much higher risk of developing sepsis, which is a serious bloodstream infection, and failure of passive transfer, or FPT.
FPT. That means they didn't get enough colostrum.
Exactly. They might have been too weak or disoriented to nurse effectively in those critical first few hours, or maybe the stress affected absorption, so they don't get those vital antibodies from the mare's first milk. And you can see other problems too, like respiratory distress from inhaling fluid or issues with kidney function, other organs.
So these foals need intensive care right away.
Absolutely. They need a thorough vet exam immediately. Blood work is essential, checking their blood cell counts, organ function, and definitely checking their IgG levels to see if they got enough antibodies. Many will need supportive care, maybe intravenous fluids, antibiotics, supplemental oxygen, and sometimes even hospitalization in a neonatal intensive care unit.
What's the overall prognosis for these foals? Does it sound pretty guarded?
It is guarded, yes. Survival really depends on how quickly the intervention happened and how severe the oxygen deprivation was. Even the foals that survive often need significant medical support, sometimes for weeks. And unfortunately, some may have long-term neurological deficits because of the initial brain injury.
Okay, that's the foal. What about the mare? What are the risks for her after going through this?
The mare also needs careful monitoring. A major risk for her is retaining the placenta or parts of it. Because the separation was abnormal, it's more likely that the placenta won't detach and pass completely like it should.
And a retained placenta is serious, right?
Very serious. It can quickly lead to metritis, which is a nasty uterine infection. And the toxins from that infection can lead to endotoxemia, which in turn is a major risk factor for laminitis.
Laminitis too. Wow.
Yes, it's a potential cascade. There's also a risk of physical trauma, vaginal tears, maybe even uterine tears from the difficult or assisted delivery.
So how does the mare usually fare? Is her prognosis better than the foal's?
Generally, yes. The mare's prognosis is usually good, provided complications like retained placenta and metritis are managed effectively. And one important point, having a red bag delivery once doesn't typically mean she's automatically destined to have another one in her next pregnancy, unless, of course, there's an underlying chronic issue, like a persistent placental infection that wasn't fully resolved.
Go. That's somewhat reassuring for the mare's future, at least. This all sounds like, as you said, something you can't totally prevent, but you absolutely have to be prepared. What are the key takeaways for people managing pregnant mares? How can they mitigate risks and be ready?
You're right, there's no magic bullet for prevention, but risk mitigation and preparedness are everything. First, close observation is key, especially in those last weeks and days of gestation. Knowing your mare's normal behavior and recognizing the early signs of labor is crucial. Second, if fescue toxicosis is a potential issue in your area, you absolutely need to manage it. That means removing mares from infected pastures well before their due date, typically the last 60 to 90 days of gestation, or using a veterinary prescribed antagonist medication.
Okay, manage the fescue. What about placentitis?
Addressing placentitis is critical. If a mare shows signs like premature udder development, dripping milk early, or any vaginal discharge, she needs to be checked by a vet immediately. Regular ultrasound exams late in pregnancy, especially for high-risk mares, can help diagnose placentitis early. If it's caught, treatment with things like antibiotics, anti-inflammatories, maybe hormonal support like progestins, can sometimes help maintain the pregnancy and potentially prevent a premature separation.
So veterinary checks are important.
Definitely. But perhaps the single most important thing for any owner or breeder is simply being prepared for the possibility. Have a foaling kit ready and easily accessible.
What should be in that kit, specifically for this scenario?
Well, besides the usual things like clean towels and gloves, you absolutely need those umbilical clamps or clean string, a good antiseptic like chlorhexidine or iodine for the navel, and critically, something sharp and clean like sturdy scissors or a knife, specifically for opening that red bag if needed. But beyond the physical kit, the knowledge is paramount. Knowing how to recognize a red bag instantly and knowing exactly what steps to take without hesitation, that is the most crucial preventative measure against losing the foal.
That really hammers it home. The knowledge and the readiness to act. We've covered so much vital ground today, really understanding what a red bag delivery is, that stark visual difference between it and a normal birth, and crucially, those immediate non-negotiable steps for intervention. It's clear that knowing just these few key things can, quite literally, save a life in that incredible high-stakes moment.
Absolutely. Preparedness makes all the difference.
It really does. And as you listening, take this information forward. Maybe think about this. Where else in life do we encounter these red bag moments? You know, situations in completely different fields, emergency medicine, maybe tackling a complex business problem, even personal crises, where recognizing a single distinct red flag sign and having the knowledge to act decisively and immediately is the absolute key to a successful outcome. What does this equine emergency teach us, more broadly, about the power of being prepared, of having focused knowledge, and trusting ourselves to make that rapid response when everything is on the line? Something to consider, perhaps? We hope you'll carry that lesson forward, understanding how knowledge and preparedness empower us all in those critical moments, whatever the context might be.